Health outcomes in any country are the result of how different sectors work together to reduce the burden on the health sector. This may include, for instance, the education sector, the water and sanitation sector, and the agricultural sector.
So is health money in police? Is health money in agriculture? Is health money in water and sanitation? There could be health money in other sectors, meaning that to improve health, we should also be investing in those other sectors to the extent those sectors contribute to improving health. And we call that multi-sectoral health programming.
This video is an example of how the road sector in Uganda has contributed and can continue to contribute to health outcomes in Uganda.
With the road carnage statistics painting a grim picture, Masaka Road has become a death trap. Scores who stormed the accident scene found horror.
It is unfortunate that accidents have increased on Masaka Highway, particularly in the areas of Nsanji up to Lukaya. This is where we are in Katonga region.
Road and traffic accidents are a serious burden to society. They cause about 1.4 million deaths and 47.8 million RTA-related injuries. In developing settings, RTAs cause huge social and economic losses. Over 10,000 deaths are particularly among the ages of 15 to 29 years, the most productive age group. The economic loss is over $101 million per year. These road accidents result in huge losses to households, communities in terms of resources used to care for the injured, as well as supplies used in the health sector.
Because the life, people dying in accidents, you can't replace them. And there is a lot of resources that are lost when accidents occur. Billions, we can save those billions besides human life greatly by improving on our logistical support to reduce these crashes.
The economy also loses in terms of time spent away from productive work for both the injured and the caregivers. Costs to both households and the health sector can be minimized by leveraging investments in prevention efforts to reduce road traffic accidents.
Road safety, if addressed, we may make savings in the health sector. Those beds will not be full of these people who stay very long with their bones broken. They spend 6 to 12 weeks in the hospital, and that's a lot of money.
Lost life, 22 have died, 19 are in hospital, we don't know their fate.
Total health amount of resources diverted to emergency medical care and savings accrued from investments in non-health sectors are enormous. Uganda has one of the highest RTAs globally. The countrywide improved road network has come with its own challenges. In 2016, the reconstructed Masaka-Kampala Highway saw a high increase of fatal accidents on the road.
Every day you would get 3 to 5 crashes where many people would be killed and several others injured. So those crashes took same patterns, overtaking in corners. And these accidents occurred shortly after Uganda National Road Authority had completed repairing, resurfacing the Kampala-Masaka-Mbarara-Kabale Highway. And they introduced what I call a third lane, a climbing lane in some areas where there are hills. Motorists were not used to these climbing lanes. Up to now, they are not used to them. They don't know what they mean. So they tend to overtake when they are not supposed to overtake. and as a result, they are head-on collisions.
Accident hospitalizations rose from 15 to 40 accidents per week. Several hospital budgets were disrupted. Supplies were depleted. They suffered stockouts. Moreover, deaths occur mostly among males, creating orphan households with all their accompanying challenges. For that, an operation codenamed Fika Salama, meaning Operation Arrive Safely, was launched.
What we did with UNRWA, Ministry of Works and Transport, we came in, identified dark spots where those accidents were occurring. And actually accidents were occurring in same places. We identified and we put there checkpoints so that when motorists approach those areas, they would reduce speed. And we termed that concept Fika Salama.
3 months before the launch of Fika Salama, about 200 people had died on this road because of road and traffic accidents. This raised concern and government swung into action. A partnership between police, Uganda National Road Authority and the courts was formed. Several roadblocks were mounted along the road, especially around the black spots. This was to slow down the motorists, but also to arrest and charge offenders. This was done on such a large scale that no offender was spared.
UNRWA supported us with resources. We would even patrol in between and communicate the checkpoint. Motorists who were driving recklessly, and they would be intercepted. So motorists knew that they were being followed. We used both intelligence and the overt deployment, those in uniform.
What outcomes did Fika Salama have?
So there was a significant reduction of accidents on the highways because of Fika Salama concept.
There was a reduction of over 83%. This reduction in fatalities of over 83% was welcome news in that it far exceeded the 50% annual reduction in road traffic fatalities recommended by WHO.
Because of this, a study codenamed Health System Cost Savings Attributable to Operation Fika Salama in Uganda was conducted. The study was conducted by Makerere University School of Public Health and the Uganda Police through a 5-year European Union-funded SPEED project. SPEED stands for Supporting Policy Engagement for Evidence-Based Decisions for Universal Health Coverage in Uganda.
So that study was done partly to look at what was spent in Fika Salama to get those benefits and how much more should government plan in this budget to put on other highways. If we were to cover at least the major highways, what more money should we plan for? How much manpower or police boots we are going to put on the road in a way to ensure that overall we reduce the injuries.
The study highlighted the health facilities handling road traffic accident victims along Kampala-Masaka Road.
These hospitals were getting very many accidents to the extent that they were actually in the process of building new emergency units to deal with the many accidents. After Fika Salama, these investments like building a new theater in Kokasi became a problem.
The study looked at the cost savings attributed to Fika Salama along Kampala-Masaka Road for the possibility of a country-wide scale-up.
How does the health sector save money if police was able to control traffic? So here is an example of how can we spend money outside of health but bring benefits to health. If you go to somebody who has lost someone on a road traffic accident, how many lives would be saved?
From this study, we've been able to establish that leveraging medical outcomes on investments made in other sectors like Uganda Police, Traffic Department is an efficient way of reducing medical expenditures and reducing fatalities and road traffic accident injuries.
For us, Fika Salama is a demonstration that when we say let's increase the health budget, we tend to believe that all health will come from the health budget, which is money going to hospitals and health centers. And yet money, if went to police and police invested it effectively in some areas, like road traffic, you could actually achieve health benefits in a sense that health does not improve from treatment and care, but also from other areas of government sectors that they need also to put money there, but also to ensure that that money is going for those interventions that we know can bring a benefit.
It is a beautiful concept, provided it is supported. Because if you put checkpoints alone without having deployments in between checkpoints, motorists get used to checkpoints and they will behave when they are approaching the checkpoints, but misbehave immediately they leave the checkpoints. So the more need for patrol in between, motorized, it has to be motorized if you are to cover a wide area. Because if it is foot, somebody cannot patrol more than a kilometer. We need that. And also we hope when we have the CCTV cameras, someone in the command center will be able to communicate to the next checkpoint to take action. The CCTV cameras will assist us very much to deal with these motorists who are overspeeding, who are driving recklessly, because among the cameras will be automatic number plate, those that recognize the number plates and also capture the speed. So it is a matter of communicating now the next checkpoint.
But using Fika Salama as a case study, more could be achieved.
We find that scaling up Fika Salama is more than necessary right now. However, given the increase in the minor injuries that was witnessed during the time the operation was in force, we find that while scaling up Fika Salama, the next implementation phase also needs to include a component that will address road traffic injuries in the feeder roads adjacent to the main road, such that we have a more complete reduction in the total number of road traffic injuries.
The patterns of accidents have changed. Between here and in PG, you don't get many accidents in a month. But in PG district, records many accidents in a month because they are now off-roads. They are off-roads where we can't control very much using this concept. And borders are knocked every day, they knock people. So the patterns have shifted to maram roads or tarmac roads which are off the main. We need motorcycles. They can do a good job. A motorcycle can carry another person who is radio communication or telephone communication, and they link with the checkpoints in between, so that motorists know that they are being watched. We need to put infrastructure on those checkpoints. Currently, we don't have. So when, for instance, it rains, the likelihood of the checkpoint being abandoned are high. But in the near future, if resources become available, dualizing the highways would solve the problem. Because many accidents in Uganda are head-on collisions. So if you dualize, you will avoid head-on. You may be knocked from behind and dangers are not as much as when it is head-on. I wouldn't say that is too much money we require, no, but we can also phase. We can say now we can buy some 2-3 vehicles for Masaka Road. Then the next financial year you go on this, buy a tent, put mobile toilets, because people, their challenges those checkpoints are facing, and they are real, And if you don't improve the morale of the people who man those checkpoints, 24/7, we are talking of 24/7. At 3 a.m. somebody is there in the court, even if you have given him a jacket, but at least he needs where to sit, because that person is a human being.
We believe that enhanced traffic enforcement through initiatives like Fika Salama could also greatly reduce the total number of road traffic accident-related injuries.